508. All right, so it's Monday, July 6th, and hopefully you guys had a relaxing 4th of July weekend and we're safe and sane. And maintain your social distancing and wear a mask. That's all we can do at this time, guys. If you guys ever want me to do a lecture about this, I've been doing many lectures about uh, the sociology and biology of SARS-CoV-2 and subsequent COVID-19 disease. And so, yeah, just, we can take a survey if you guys want some more information on that. I don't want to burden you with it, but I have a lot of information on that. Okay, so today we're going to go back to our class. We're doing the mind to body connection. We are looking about different aspects of mental health. Okay, we kind of zoomed in on anxiety, depression, PTSD, and how that recruits the stress response physiologically. And now we're making the next kind of logical jump and real significant health consequences that happen with chronic stress. And we're making that link to diabetes and and then with diabetes, all of the associated health conditions that people have, increased risk of heart disease, stroke, kidney disease, and immune suppression, and on and on and on. So this is the real deal. And so let's go ahead and launch directly into it. As you guys all know, your exercise in writing a paper is due today. Okay, and again, I don't want people to stress out about this. Just kind of be creative, as best you can, and it's supposed to be fun, but to learn the format of a lot of what you're reading in terms of the weekly readings. Okay, and that being said, this particular week, um, there's a lot of redundancy, I would say, in the readings, um, and I don't want you to be taken aback by that. So I was going to take you through how to approach um, these different readings that I've assigned. Okay, so we have 1, 2, 3 very short videos that give you a real good kind of basis for what we're thinking about, and then we kind of launch directly into these articles. All right. Like always, I always like to give you the URL right here, as long as you have access to the journal. But just as backup, we also have the PDF file. So we can go jump right in here to this particular article. And I mean, the title says everything. So it says cortisol dysregulation, the bidirectional, meaning going back and forth, link between stress, depression, and type 2 diabetes. One thing that kind of irritates me is that there is this methodology in literature where a lot of acronyms are used, and so you will see this in all these papers, and sadly, there's sometimes people create their own acronyms, and there's a lack of consistency, which sucks. Okay, this one right here, of course, we've done numerous times: the hypothalamic pituitary adrenal axis, or the HPA axis. Okay, and so it talks not only about this with the end result being cortisol, but then also we had talked about the autonomic nervous system and immune systems are influenced by both cortisol and the autonomic nervous system. Okay, so in their study, okay, they looked at depression. They did cross-sectional analysis, and that is where you sample an age group, and you define that age group, say 25 to 45, and you just look at everybody that's 25 to 45 at that one moment in time. So that's just a cross section of the world at that one moment in time. Okay. The other thing is to get somebody and follow them longitudinally and watch how, on an individual basis, the disease condition as related to stress, depression, type 2 diabetes progresses, say, over a 10-year period of time. So this is where you have to rely on giant international databases where the researchers have had these longitudinal studies, and they do as many different types of individual sampling of different types of variables, so that depending on who you are, you can just pull one variable and write a paper about it, or pull 5 variables. Okay, it's incredibly difficult to do longitudinal studies because of the cost. You think about the cost of running something over a 10, 15, 20-year period of time. Pretty hard. All right. So they do talk a little bit about, and I'm going to show this in a couple papers. We do have what's called a diurnal cortisol curve. So when you first get up in the morning, you need to activate your brain, and you also need to cause a kind of a freeing up of glucose. All right, and so this is the whole point of this. Okay, so you basically are putting gasoline in the tank. Okay, cortisol gets released, goes straight to your liver. Your liver then does this process of called glucose neogenesis or new formation. That's what that means. So you form new glucose from some of the building blocks that exist in the liver, and then that glucose goes straight to your brain, so that you have uh, a good solid supply of fuel to get up and get going. Okay, and that's what that's all about. Alrighty. Um, Alrighty, so there is quite a bit of review here. We have already got through all this, and so with respect to these papers, you're welcome to read through this and just and further solidify your understanding. But it's important also to be able to just bounce around and look at what it is you want to learn. Um, Maintaining homeostasis, that is the optimal performance of any system. So that's what they use. Again, science has to use vocabulary. They can just be so irritating. They talk about allostasis, and that's the capacity to maintain homeostasis. God help us, okay? And the allostatic load, okay, is kind of why we have to use that word allostatic load is beyond me. Okay, it's the cumulative threat to your health, the cumulative disease impact on your future health. Okay, and we can talk about allostatic load with respect to anything. A lot of people are really vulnerable to viral infections. That's one form of allostatic load that's immune related. You can have the stress part that we're talking about with cortisol, on and on and on. That's what this is all about. All right, cool. You just kind of read through it as pleasure. This is a pretty incredible block diagram. All right, and so we're looking at again psychological stress. Okay, we're all under quite a bit of psychological stress right now, and what's good is in next week we're going to start honing in on what we can do to control it. And so you guys are going to become practitioners of intervention. And at the same time, just like writing the study, you could even monitor how well your intervention is working. And I could envision down the line over-the-counter salivary cortisol tests that you could have on hand in your facility, where you would just be able to monitor how well the intervention is working longitudinally in all your patients. Okay. Alrighty, so we have this psychological condition right here. As we have talked about, it's a fight or flight response, and so you have this super activation of the hypothalamic pituitary adrenal axis that increases levels of blood cortisol. Okay, this is we don't do this just to get sick. This is purposeful. It is all about activating our system so that we can best fight off a challenge. And then remember, it's feeding back to the brain. So can we shut this off? And then if the challenge is a lion right here in my face, the answer is no, and you keep driving it. Okay, the challenge is up here. That's something that we're going to learn how to control using medication, exercise, and stuff like that. The second limb to the fight or flight response is this automatic component that we don't have to think about. My pupils get giant. Okay, my heart starts to race. Okay, so this is the autonomic nervous system that releases. Also, the most important is the sympathetic part. Okay, versus the parasympathetic, which is rest and digest. And you release both epinephrine and norepinephrine, and they coordinate your body to be able to fight off this challenge. Both of these activities, cortisol, chronic cortisol, and chronic norepinephrine, create the perfect storm sadly, for inflammation. Okay, sometimes directly and sometimes indirectly, but the bottom line is as a clinician, and you guys, can certainly be a part of this type of study. You can look at these two critical inflammatory proteins. This one right here is released by mostly immune system, but also cells that line your blood vessels, called interleukin 6. And then CRP is the liver's response to, it's kind of just like a thermometer, where it's the liver monitoring how much IL-6 is there, and then when it hits the threshold, then boop, CRP levels raise. So this is the very traditional, and you can get your CRP levels measured all the time. Okay, this can be done, ordered by a primary care physician. High levels are associated with insulin resistance that leads to diabetes. And how are you going to know you're a diabetic? Well, you would have um, your fasting blood glucose would be elevated, your glucose challenge test glucose numbers would be elevated, and then the best measure is the HbA1c or hemoglobin A1c, which is a measure of kind of the chronic candy coating of this protein. Okay. Um, we get from all this with insulin resistance, and you're chronically elevating glucose for no reason, and then the glucose gets converted into fat, and studies have shown that it gets converted into visceral fat, also called abdominal fat. So you'll see it both ways, okay? But you'll see, this kind of apple shape, this giant waist circumference, okay? This is the perfect storm for elevating triglycerides, okay? Having also high levels of free fatty acids that further increase insulin resistance, okay? And then this is the special transport protein that will get rid of the fat and take it back to the liver that's storing up in your tummy, but it goes down. So this, I call this, it's high density lipoprotein. I call it happy. It's just for happy. The other one that's not shown here is the LDL, the low density lipoprotein, which is lousy, okay? And that's the one that is high risk for causing vascular disease, okay? All these can cause dysfunction, okay, in your vasculature. They're honing in right here, okay, on the vasculature that goes to the kidney, and you'd have a readout of that as well. Okay, so you could do just a urinalysis and you see these problems. So these are all conditions that are diabetes. Okay, now again, there's a lot of verbiage in here. Okay, that you are more than welcome to study. A lot of it is a review. Okay, this is a big review. A meta-analysis meaning they've looked at lots of studies. That's what a meta-analysis is all about. Okay, so this is just a cartoon. Okay, so this is the normal. Whoosh, we get this big burst of cortisol and it comes racing back down in the later part of the day. So this is just to get you up and going. And this is what happens. It gets blunted, and the curve just has a real. Oftentimes it'll be flat. Everybody's different, but it's irregular, and it's a readout of kind of a depression-related dysfunction of the HPA axis. Okay, and that's what that's all about. So they go through. Again, I told you the type of study, so they could be. This could be a cross-sectional. This also could be a longitudinal. This depends on the study that they're looking at. Okay, so they're just like you guys were doing. You can look at salivary cortisol. This is this is the classic measure. You still need a laboratory measure for this, but someday this could be standard of care for all of us. It could be just like going and getting some Advil. Okay, and then you have somebody that is a specialist that will do the behavioral monitoring. Okay. So they go through all that. And you see how quick I'm going through this because I don't want to be bothered with all this. Okay. You can look at older adults versus younger. Okay. This is the diurnal curve that I was talking about right here. They do talk about this that treatments. Okay. Sorry. With selective serotonin reuptake inhibitors. Okay. This would be the traditional antidepressants like Prozac. And then you combine that with cognitive behavioral therapy, okay, that it causes a reduction of cortisol irregularities, which is kind of cool. All right. They go through different types of stressors, okay. Socioeconomic stress, okay. So we can have work-related stress, all right, where and this can happen at all levels, okay, of socioeconomic status. Discrimination, okay. So this has been, I think, very topical. When I think is totally topical. something that we as a society have not paid attention to. Okay, and so I think it's upfront, and we all need to pay attention to this. And so it talks about the stress of discrimination that experienced by African American adults, right in here. Measure, this is not some like just self-reported. We can measure their salivary cortisol and see that it's a real physiological response, and that's an important component to this. Okay. Um, they talk about socioeconomic status as well, right? So these are all the different levels of the stress study and how it was performed. Okay, it will be like a method section in your paper. Okay, and so we're seeing differences in the way the curves look. And if you were a specialist, um, then you would look at this and say, this doesn't look right. Some more severe than others. Okay, and neither here nor there. This goes into the kind of biology that we've talked about. So normally the hippocampus is keeping this in check, the hypothalamic, pituitary, adrenal axis. Okay, so there's normally a certain level of inhibition that is when you lose your glucocorticoid receptors, and as we talked about in previous examples, this is the cortisol feeding back, activating its receptors. When these receptors become diminished, so we see the two different receptors shown right here, they're diminished here, and here. Remember, the mineral one is a little more adaptive, and here's all the, hey, shut this off, hey, shut this off, hey, shut this off. That's the love of the hippocampus, hypothalamus, and pituitary. If they go down in number, then you lose your ability to inhibit. Okay, and as a result, the system has elevation. Right? It's in hyperdrive. It's in hyperdrive. It's in hyperdrive. Okay, and when high levels of cortisol happen, okay, then we see this elevation in tummy fat shown right here. We see high levels of insulin. Okay, but we at the same time, because of the cortisol's action right here, we have this insulin resistance that is being shown right here. Okay. All righty. And do remember that this guy dies off later on too. So we saw that in the Sapolsky videos and all his discussions. So not only do you lose the receptors, but ultimately chronically activating the system causes death to the hippocampus, the shrinking of the hippocampus. Okay. All righty. So stress. Okay. What kind of stress we talk about? Work stress, low socioeconomic status, anxiety, depression, high levels of cortisol. You can measure this with blood levels and also with salivary cortisol to see that you have this weird variability. Okay, this then is done through correlational analysis, and you see elevated obesity and insulin resistance. How would I test that? HbA1c, fasting blood glucose, and a glucose tolerance test. Okay, and you have then the diagnosis of type 2 diabetes that is then associated with so many other additional disease conditions. Okay, all right. So you read through that. Okay, at your own level, at your own pleasure. Right. That's the whole point of this. Okay, don't want you guys stressed out. Okay, all right. Cool. Now again, this is a bit redundant, but I just want to show you this. The reason I put all these articles in is I just want you to realize that this is such an important topic. Here's the URL for this article right here. And this is a fairly significant review article, okay? And again, you can just read the abstract and you can look at the link between type 2 diabetes and sociological factors, and then they go nuts and they give us their own acronym, physiological stress response. You'll see all throughout, of course, socioeconomic status. That is a more familiar um, uh, um, acronym that we have right here, type 2 diabetes. Okay, so they do get into I think what are really important topics. Okay, we have suffered as a culture, as a country, where one of my best friends, that is a physician. He's specializes in medical care for the disenfranchised. Okay, and for the people that get left behind. And he recently wrote an article about the heavy burden of the African American population in our country for SARS-CoV-2 infections, and that they're getting COVID-19. And it is in large part, when we look at something like this, it's the cumulative effect of not having access to medical care and not being treated adequately. And so it's a big deal. So his specialty is humanitarian medicine. His name's Tyler Evans, and I'll send you a link of a discussion I had with him earlier in the year. All right, so they go through, what is type 2 diabetes right here. Okay, again, this is something that you guys would have could use in terms of your future studies. All right. Once again, they're talking about the cumulative exposure to stressors. This is the allostatic load that we were talking about. Okay, so a lifetime of stress. Who's getting that? And how does that link to socioeconomic status? How does that link to race, ethnicity, all that? Okay, all right. So they go through all this. Here's the hypothesis of stress. Okay, um, and again, these are scientists. So they have a real scientific way of looking at this. So they talk about poor mental health. Okay, PTSD right here, and they talk about the socioeconomic gradient. Okay, all these little things. And then as you get into this cross-sectional analysis, they see how these behavioral factors for type 2 diabetes can be linked to obesity, family history, genetics are huge, poor diet. Again, that's so socioeconomic, and lack of physical activity. Okay, it's a luxury to be able to go to the gym. It's a luxury to exercise. And this it becomes a real haves versus have-not scenario. All right. Okay, so then they go through, again, this is a big study, all right? So there, again, you can, it's a meta-analysis, you can see all the different groups that they're looking at right here, okay? So then you come down here and you get back into it, and they do a little historical analysis. So this was, again, something that we found, okay, from the Sapolsky video, okay? And then again, more description of the meta-analysis. It shows you the complexity. And then what I like is they get into mental health right here. Okay, and they talk about the effect of chronic mental health on chronic poor health conditions like diabetes. All right. They then from mental health get into individual predictors, aggressive behavior and conflict. Okay, they are positively correlated with developing cardiovascular disease, and now they're finding this is stress-related diabetes. Okay, and so they go through the mental health conditions right here. Okay, this one right here, effects of position in the social status hierarchy. So we saw that in the original Sapolsky video. Again, what I want you to do is just read through this at your own pace. This is a long article, so you decide. Okay. And then here's just an overall view of what we're talking about. This is the allostatic load, okay? Exposure to chronic stressors, socioeconomic, racial inequities, okay? Gender inequities, on and on and on and on. These are stressors, okay? Mental health, okay? Mental health is largely genetic coupled with environmental exposure, okay? So you have your physiological stress response, all right? The HPA axis that we've talked about, okay? These are correlated with health adverse behaviors, okay? Alcoholism, things like this, okay, where you're self-medicating. And then we have over here this chronic inflammatory response that leads to obesity, insulin resistance, dyslipidemia, and hypertension, both associated with cardiovascular disease and depression. All right? So again, it's a long article, but you can sift through it and get what you want out of this. Okay, awesome. All right, the last article. Okay, again, the URL right here, but here we are at the last article, and then this just kind of hammers in on the link between stress and diabetes. Okay, and again, you look at this and you look like this table. I mean, this says it all right here. Okay, so your normal hypothalamic pituitary axis. Okay, there is very little visceral obesity. Fasting blood glucose is not an issue. Fasting insulin is not an issue. Triglycerides are not an issue. Total cholesterol is low. LDL is low, which is good, and HDL was not an issue. You see right here, these are all adverse outcomes, all right, that could be measured as in a study, all right. They get into the hormones and how it causes visceral obesity right here. Okay, so again, you can read through this. This is all review of the disturbed um, HPA axis, okay? And then they get into pathological consequences. And this is at the, now you guys are doing kind of biomedical stuff, okay? And again, it gets into this concept that I was talking about when we have excess glucocorticoids, okay? Um, it promotes release of free fatty acids from your tummy. That's what this is right here, okay? This is the primary enzyme for converting triglycerides into free fatty acids, all right? All right, so what they see is that if we were to get rid of the cortisol, this is an adrenal lectinized animal, okay? They see that free fatty acids are reduced, okay? In these papers, they also talk about Cushing's syndrome, and this is where you have a benign tumor on your adrenal gland, and so they have all these problems. They have um, enormous tummy or visceral fat, abdominal fat, and cardiovascular disease, and immune suppression, all these things, and they can treat them with a glucocorticoid receptor antagonist. Okay, and I was just looking at it right here. Mifepristone is the traditional treatment for Cushing's disease, and it gets rid of all these problems. However, there are lots of side effects with this. You can also get Cushing's syndrome from chronic use of steroids to reduce inflammatory responses, and that's what it does. Steroids reduce inflammation, but then as a consequence, you can have a lot of disease from that. So people use it for psoriasis and for asthma. If you're having joint problems, you have steroid injections, but you have to really limit how much you can take in. Okay, so back to this article right here. So they kind of go over this concept of elevated free fatty acids from your tummy fat. Okay, so it gets released. And when you have a lot of fatty acids released from your tummy fat, it induces a hyperinsulinemia because you are now, it's a major contributor causing insulin resistance. Okay. All right, so they go through again the model here. Okay, you are genetically predisposed. So if this is happening in your family, you are at super high risk, and you combine that with a lack of exercise, with a poor diet. Okay, you have hypersecretion of cortisol. Okay, this is again in the morning. Its job is to increase glucose production, but not to do this chronically. Okay, um, and it messes with our muscles in terms of short-term energy and increases fat. Okay, and then in the end, you're going to get decreased insulin secretion. Okay, which again further increases fat. So, anyways, that's a quick review of all three articles. Again, do open the quiz as you're going through this. Okay. And so we looked at poor health outcomes. Okay, epigenetics and stress. I want you guys to start talking about a lot of things we've been talking about, changes in receptor expression. We looked all through this, okay? And then, so that one figure I was looking at in that one article, okay? So just kind of go through this and just, I want you to start connecting the dots, and that's the point of all this, okay? All right, guys, so that's it for right now. You guys I know the biology is kind of blowing you away, but I just want you to just take it in, and you guys are going to do just fine with all this stuff. I promise you. Okay. All right. So I'm going to do the second lecture here in a second, and look at Julie. She's so beautiful. All right. And we're going to stop right there.